Learn GMP presents Deviation Management. Steps. Introduction. Define deviations. Reporting. Immediate assessment. Risk assessment. Investigation. Corrective and preventive actions. Documentation. Review and approval. Implementation. Follow-up and verification. Continuous improvement. Summary. Introduction. Managing deviations in a pharmaceutical good manufacturing practices (GMP) environment is crucial to ensuring the quality and safety of pharmaceutical products. Here are the general steps for managing deviations in a pharmaceutical GMP environment. Step 1. Define deviations. Deviations are departures from approved procedures or specifications. These can include issues related to equipment, processes, materials, or documentation. Step 2. Reporting. Any deviation should be reported as soon as possible after discovery. The person who discovers the deviation should document it and notify the appropriate personnel, such as supervisors, quality assurance, or quality control personnel. Step 3. Immediate assessment. An initial assessment should be conducted to determine the impact of the deviation on product quality, safety, and efficacy. This assessment may involve stopping production or distribution of affected products if necessary. Step 4. Risk assessment. A formal risk assessment should be conducted to evaluate the potential impact of the deviation. This assessment should consider the severity of the deviation, the likelihood of occurrence, and the detectability of the deviation. Step 5. Investigation. A thorough investigation should be conducted to determine the root cause of the deviation. This investigation should involve a cross-functional team that includes relevant subject matter experts. Step 6. Corrective and preventive actions, CAPA. Based on the investigation findings, appropriate corrective and preventive actions should be identified and implemented to address the root cause of the deviation and prevent its recurrence. Step 7. Documentation. All aspects of the deviation, including the investigation, assessment, and corrective actions, should be thoroughly documented in a deviation report. This documentation is critical for regulatory compliance and for demonstrating that appropriate actions were taken. Step 8. Review and approval. The deviation report, along with the proposed corrective and preventive actions, should be reviewed and approved by appropriate personnel, such as quality assurance, before implementation. Step 9. Implementation. Once approved, the corrective and preventive actions should be implemented in a timely manner. This may involve changes to procedures, training, equipment, or other aspects of the manufacturing process. Step 10. Follow-up and verification. After implementation, the effectiveness of the corrective and preventive actions should be monitored and verified to ensure that the deviation has been adequately addressed. Step 11. Continuous improvement. Organizations should use deviations as opportunities for continuous improvement by identifying trends and systemic issues that may be contributing to deviations and taking proactive measures to prevent future occurrences. Summary. It's important to note that these steps are general guidelines, and specific procedures for managing deviations may vary based on the organization's standard operating procedures, regulatory requirements, and the nature of the deviation. Learn GMP Incorporated. Learn GMP Incorporated is a leading provider of GMP training and consulting services and is committed to helping individuals and organizations achieve excellence in the pharmaceutical and biotech industry. Contact us. Contact@learngmp.com.